at least 4 different types of rosacea that we are aware of, and we can treat them different ways. So we'll go through the 4 types first, and then we'll talk about some of the ways we can treat those conditions, okay? So the first type of rosacea is what we call erythrotelangiectatic. Do not say that 3 times fast. Erythrotelangiectatic is basically the one where you just have redness of the cheeks, sometimes a little bit of blood vessels, and as we treat these patients, we tend to treat them with anti-inflammatories and some laser for their rosacea, usually IPL or OPL, okay? And then we have the mixed type of rosacea here at the top left, and that is the patients who have the red, the acne, and they have a lot of inflammation. These patients technically usually need some antibiotics in order to get the acne component under control, and then after that's under control, we'll treat the redness the same way we treat this kind. Unfortunately, some people can have the acne component only, and we treat that more like an acne with medical treatments, okay? Third form is the rhinophymatous form, sebaceous form. There's a couple different names for it. But these are the patients that you think have been alcoholics, and we used to talk about W.C. Fields and that with the larger, thicker, sebaceous skin on the nose. And it's not really from alcohol. This is hypertrophy of the sebaceous glands of the skin, causing a thickening of the layer and giving them that almost like warty texture of their skin. So we can treat that surgically and sometimes with lasers. So it's not from alcohol. It is definitely something that is a medical condition. Last form is ocular rosacea. I don't treat ocular rosacea in my practice, but I know some great optometrists in town that have some lasers and some medical treatments for ocular rosacea, if that is the form that you happen to have. All 4 can exist kind of in the same person, or you can have an isolated version of one of the 4 of these. Rosacea comes from a couple of different factors. There are some environmental triggers, including heat and some histamine-releasing foods that can cause the blood vessels to dilate. There's definitely a genetic component. We tend to get this as an adult, not as much as a kid. And then also sun does play a role, especially in the erythrotelangiectatic form. To treat the different forms of rosacea, we use different modalities for each different kind. For the erythrotelangiectatic kind, we use IPL or OPL lasers. Multiple treatments are usually required to keep the redness down, but we can make a really good improvement in that redness with IPL.